Well, I'd like to welcome everyone to this webinar and to our session here today. What we're going to do is introduce a report that BBC has just released this last week on the what will it take to build a competent and stable childcare workforce. My name is Linda Smith, and I'm the director of the Early Childhood Initiative here at the Bipartisan Policy Center. Today, we're going to talk about this report, and we have I guess, a very illustrative panel here to have the conversation with us about where are we going with the workforce. I want to start by explaining to our audience that this report is about center-based early care and education personnel. We intentionally did not take on the family childcare, home-based childcare community because the responsibility for them is much more complicated than a single employer. So when they work for several parents at a time, some of these things become a lot more complicated. So this session will talk specifically about center-based care and the staff that works in them. It does not, I need to stress, introduce new ideas. What we tried to do with this was to pull together recommendations from trusted sources that have spent probably decades actually doing this work, and not reinvent the wheel, but try to figure out how we take what we know and have done and weave it into a comprehensive approach to the problems that we are facing right now. And one of the things that we have concluded, and you'll see in the report, is where the real power and authority might lie in terms of moving the profession forward. We used, as you will note in the report, many sources, starting with, I think, one of the most important done was the National Academy of Sciences report, Transforming the Workforce. And it took pretty much the same position that we ultimately concluded in the report that we did. In addition to that, we looked at the NSE, the National Survey of Early Care and Education, done by the government through the Office of Policy, Research and Evaluation. We looked at what was done by the McCormick Center, the Council for Professional Recognition, the Center for the Study of Child Care Employment, the National Workforce Registry Alliance, and the NAYC work on power to the profession, plus others. You'll see those in the report itself. But what we know is that the pandemic exposed the cracks and fissures in our nation's childcare industry and highlighted what I would say is the very unfortunate reality is that we have a childcare workforce that itself relies on public assistance for a lot and is essentially one of the lowest paid workforces in the country. And so what are we going to do about that? The other thing, not only are they, the pay scales low, they lack, annual and sick leave, they lack access to health care and other benefits. So what we decided to take a look at is how do we begin to deal with the fact that these are very complex businesses that require both what we would call professional development system that could ensure and support their understanding and ability in terms of both business as well as the pedagogy that is needed for early childhood. So one of the things that we have been having lots of conversations about have been the issue of, is this a profession or is it not? And I think we all know the answer to that. We were just talking about that before the session started. And we need to begin to deal with how do we make this an actual profession? Then you add to all that the fact that we lack data on this workforce. As much as we talk about the need to improve the pay and compensation, we don't know exactly what we have out there in every state in this country. And I think finally, the final thing I'll say before I'll introduce our panelists is that we are focused in on the fact that we in this country on an annual basis spend over $1 billion on quality through the CCDF fund. When you combine the TANF transfer and the actual requirement for 12% of funds to be spent on childcare quality, we have to ask ourselves, what are we getting for that? And if the most important thing that the research tells us is that child care quality depends on the adult-child interactions and the support of the teachers, then we need to begin to focus in on them and look at how we use the quality dollars that we are spending in this country every year. So now I'm going to introduce the panel before we get started on and give you an overview of the report. I have four highly regarded national figures with me today. First up is Walter Gilliam. He's not a stranger to our audience here. Walter is the executive director of the Buffett Early Childhood Institute at the University of Nebraska. He came to that institute from Yale University, where he was a professor of child psychiatry and psychology at the Yale Child Study Center and director of Yale's Ed Ziegler Center on Child Development. He's widely published in this field and cited often for his expertise in early childhood care, education, school readiness, and especially mental health, which we want to have a conversation about the importance of mental health and our workforce. Next is Lauren Birchfield Kennedy. She is a co-president and chief strategy officer, getting my tongue twisted here, at Neighborhood Villages, a Boston-based nonprofit that advocates for solutions to the greatest challenges faced by our early childhood sector. The one thing I would say about Lauren, and I've known her now several years, is that she's not afraid to try anything, and she is not risk averse. And so I think we will learn a lot from what she has been doing in the greater Boston area and in Massachusetts when it comes to looking at the sustainability and scalability of programs that she works with in the Boston area. Next, we have Marika Cox-Mitchell. Also longtime advocate for this early childhood and a really progressive, innovative future thinker on this issue of the workforce. For those of you who know Maria from her past, she is the vice president of the early childhood work done at the Bainham Foundation here in Washington, D.C. And prior to that, she served as the Deputy Executive Director of Early Learning Systems for the National Association for the Education of Young Children, where she led the portfolio that included Power to the Profession, which we have discussed in our report and we'll talk about more. And then finally, longtime co-worker and friend, Calvin Moore. Calvin is the Chief Executive Officer for the Council for Professional Recognition, a nonprofit here in Washington, D.C. that administers the Child Development Associate Credential. He earned his CDA 3 decades ago, Calvin. Yes. You're not that, you don't look that old.
Thank you.
Okay, it's, as a kindergartner. He's had other very high positions in the country, including he worked at the Office of Child Care when I was actually with the administration. He's had senior roles with the department or the Office of Head Start, and finally served as the state child care administrator for the state of Alabama. So we should have a very interesting conversation here today about this report and where are we going with our professional, with the early childhood and child care profession. So with that, I'm going to introduce Caroline Osborne. Caroline is a project associate here at the Bipartisan Policy Center for the Early Childhood Initiative, co-author of the report, and she's going to walk us through the 10 findings and recommendations that we highlight in the report, and then we'll start with our Q&A.
Good afternoon, everybody. I will be sharing an overview of our findings from our recent report, Top Down, Bottom Up, Building a State Child Care Center Workforce. Linda and I began working on this report in January of 2023 with the goal of developing a framework for policy that builds competency and stability for the child care workforce. We began our work by talking with experts across the country, and all of our conversations started with one simple question. How do you define a child care teacher? We found that answers varied widely. Those interviews set the foundation for this report, which dives into the work that policymakers and other stakeholders across the country must do to build up this workforce. This report does not introduce any new ideas or definitions like Linda said, but rather seeks to pull together recommendations from trusted sources to support a comprehensive approach to build a qualified childcare workforce. The childcare workforce includes about 2 million individuals. This is about 1.4 million working in childcare centers and 600,000 working in family childcare homes. Childcare workers tend to earn low wages and lack access to basic benefits like health insurance and paid leave. The average compensation for a childcare worker is just $13.71 an hour. 1 in 3 live in families with incomes twice below the poverty line, and half qualify for public assistance. At the same time, in 16 states, you can be hired as a teacher by just meeting an age requirement or acquiring a high school diploma. The science of child brain development shows that the quality of adult-child interactions is the most important factor for positive child development. We all want a childcare workforce that can engage in positive interactions and has the stability to build relationships with children in their care. Do these entry requirements promote the competency and stability that children deserve? Our research shows that instability in the childcare workforce is a systems-level issue that goes far beyond teacher compensation. This is not to say that the childcare workforce does not need higher wages, but to be most effective, states must build the scaffolding around those compensation initiatives. We have yet to even define what it means to be a teacher in this country. Is it education, competency, experience, or some combination of the three? What are the roles and responsibilities of a teacher versus a director versus a teacher assistant? What is the pathway for professional advancement? These are the questions that must be answered to develop durable policy. Moreover, there is a lack of data needed to make crucial policy decisions to support the workforce. It's challenging to move a workforce forward when you don't have clear and accessible data on where they are right now. We must create a profession that people want to enter. This means finding ways to finance competitive compensation and benefits, but it also means creating a profession with room for professional advancement, strategies to mitigate burnout and support mental health, and one that garners the respect it deserves. There is a key role, a person who can lead the childcare workforce transformation, but who universally goes unrecognized when we look only to federal solutions: the state childcare administrator. In our report, we identified 9 levers that a state administrator can use to influence or implement policies that support the workforce. These include, first, the state administrative structure. How states administer various funding streams and how agencies coordinate to support the workforce often creates inefficiencies. State administrators can evaluate their coordination efforts and help drive a cohesive system internally. Second is regulations. State agencies write regulations for childcare, which of course directly impact workforce requirements. Third is data collection. State departments oversee data associated with childcare subsidies, program licensing, quality initiatives, workforce registries, higher education, and more. State administrators may only have access to data that is collected in their agency. So coordinating across agencies to access data can make sure policies are designed using the most comprehensive data available. Fourth is program licensing. State administrators can evaluate their program licensing processes to better promote competency and stability. Fifth is quality rating and improvement systems. State administrators can align QRIS levels and requirements with their workforce definitions and competencies. Sixth is workforce registries. These are powerful data collection tools that, if made mandatory in states, will help ensure that we have accurate and complete workforce data. 7, professional learning. State administrators can utilize a variety of strategies, partnerships, and funding mechanisms to bring together all aspects of professional learning into a career advancement pathway. 8 is cost modeling. State administrators can use cost modeling to evaluate the optimal way to allocate public funding. And finally, 9 is quality dollar allocation. When state administrators develop their triennial CCDF state plans, quality dollars should be directed towards achieving workforce competency and stability. Our report concludes with the 10 steps for lead agencies and state administrators to build a competent, stable childcare workforce. These steps can help state administrators think through how and when to use those policy levers that I just described. Now, these steps are not a la carte. All of them are necessary to set the stage for sustainable public investment. And the first step is to define what it means to be a member of the childcare workforce. States must make it clear what it means to be a teacher, a director, an assistant teacher, a coach, and other support staff in a childcare center. In many professions, such as nursing and social work, this has meant defining the roles and responsibilities of certain positions, identifying the competencies needed to successfully execute those responsibilities, and requiring certain training and education to be able to enter the profession. And our report includes information on how the governance and structure of the nursing profession may serve as an inspiration for childcare. Next, lead agencies must determine the career pathway and education and training requirements. This means clearly showing how individuals advance from one role to the next and working with higher education and other organizations to ensure that training and education is actually aligned with the state's definitions and builds the identified competencies. Now, this is not as simple as requiring a degree or one-off trainings. Lead agencies must consider whether programs in their state are accessible to the workforce and that curriculum is aligned with the competencies they have identified. Lead agencies must also consider the ideal enforcement mechanism to ensure that the workforce is meeting requirements. In childcare, this has traditionally been done through program licensing. However, in other professions, government has partnered with professional associations to implement occupational licensing. We discussed the potential benefits of implementing an occupational licensing system in our report. Once the field has been defined and workforce data has been collected, a state can begin to undertake cost modeling to determine the total cost of the childcare system and the cost of additional workforce interventions. Cost modeling is a tool that allows stakeholders to predict costs given a set of assumptions, and setting the foundation with steps 1 through 5 will help make sure that the assumptions in a state's cost model accurately reflect the workforce and give the best estimated cost of a policy intervention. Cost modeling can help state administrators answer a lot of financing questions beyond the cost of increasing compensation. If the foundation is set, a cost model can help show the cost of implementing career advancement pathways, financing training and education programs, ensuring the workforce has access to benefits, and more. This process may help state administrators understand the total cost of their short and long-term goals for the workforce. Once the state has conducted cost modeling, they can identify the most sustainable financing mechanisms that best target their end goals. These foundational steps will put lead agencies in the best position to propose and implement thoughtful policy interventions to support the childcare workforce. Now, I know I ran through all of these recommendations quickly and probably made them seem a little too easy. All of those in the audience who work in childcare are acutely aware that this is not the case. This is challenging work, and it will take time to accomplish. But we hope that this report is a good starting point for state administrators and other policymakers who are thinking of a holistic framework for policy change. Thank you. And with that, I'll pass it off to Linda and the rest of the panel.
Okay, thank you. Well, I want to start. What we're going to do now is have each of our panelists describe for you the work that they're doing and ask a couple questions about how it relates to what we have in this report. So I'm going to start, Lauren, with you. And Lauren, in Neighborhood Villages, you partner with 5 independent programs, and you have been looking, as I understand it, to look at the systematic approaches to this. What have you learned from that, and does what you're learning from your work at the community level mirror what we're saying in a report like this?
It does. So Neighborhood Villages, for those who aren't as familiar with us as perhaps some of our other panelists here, play a more national role. We're based in Massachusetts, and our model is to innovate at a very local level. So you mentioned a very close partnership with 5 independent early education and care centers. Some of them are networks, so it stretches across about 19 program sites. We don't run these centers, and we partner with them in a collaborative. And what we learn, we call it the neighborhood program, in that space is identifying what are common challenges, what are common opportunities, a lot of those revolving around workforce. Then we seek to scale that in partnership with government through adoption into public policy and public programming. So very intentionally, our work is around how do we look from sort of bottom up, did I get that right? Yep. Top down, bottom up. We're the bottom up folks, to surface the how if this is the objective that we're seeking to reach, how would we do it? And from the neighborhood, what we really focus on within that kind of microcosm is how would you transfer a sector into a system? And we look very closely at instructional leadership and excellence, what's happening within the classroom, focusing on curriculum, focusing on coaching. So I thought it was very interesting in the report to really identify the coach as somebody who's independent of the teacher or the lead teacher and the important role that that takes in terms of building really high quality within the classroom. We also look at student supports. So what is the mental health supports that we need inside of a child care center, a school? What are the operations supports that we need inside of a school to build high quality programming? So also really interested in the dialogue today about defining the early education and care workforce. How we like to look at it at Neighborhood Villages is who needs to be in the building. We've identified teachers, lead teachers, assistant teachers, we've identified the director, and inside a K-12 elementary school, we would understand the need for administrative support. We would understand the need for operations support. Who opens the building every day? Who does the staff scheduling? Right now, all of that falls on the director. So who do we need to think about in sort of a comprehensive system? We would argue it's a very broad definition. And the ways that we will get to, right, a profession may look different if you're an operations manager versus family navigation support versus an inclusion specialist for how do we wrap around children and how do we train caregivers in the classroom to be able to care for students with special needs, really looking at that broadly. Inside of the schools that we work in, so student and school supports. And then finally, workforce development. How do we build up a very strong profession? And some of the work that we've done over the years, again, is to say, how do we pilot locally? We've done work around a program we called Professional Pathways, where we initially piloted cohorts of early educators seeking their CDA through college pathways. We can talk about this a little bit later, but the conditions in Massachusetts for early educators are I'll say positive, in that we do offer free community college for early educators seeking their CDA, but there was a gap. The educators couldn't get to the community college classes. The educators didn't know that these resources were available. So at Neighborhood Villages, did first in pilot and now have been excited to sort of hand it over to our Department of Early Education and Care is navigation supports for our early educators so we can achieve our credentialing or certificate goals, building business training into the state's targeted, professional development work with administrators. And then finally, and this is sort of our core priority at the moment, is we're now operating the largest registered apprenticeship program for early educators in Massachusetts and really seeing that as a phenomenal opportunity, not only to build up our teachers, but we also run a apprenticeship track that puts you on the path from lead teacher to director. So a way of thinking about how do we build up our senior leadership. And then thinking too, is there so much intersection between early ed and again, who else do we need in the building? If we need early childhood mental health consultants, and we know there's a shortage of those practitioners, could we think about apprenticeships for consultants who are trained to support the field of early education and care? So, Linda, as you mentioned, we are not afraid to try. And I think by being at the state level and by really localizing some of this innovation, we have, I suppose, the privilege of being able to get a little messy and dirty. We might not get it perfect first, but once we do have that blueprint to go to state government and say, want to try it this way. And hopefully, if that really kicks off, then we can help inform some of these national dialogues about how might we as a country look to really building the professionalization of this field.
I want to get back to what you were talking about with the apprenticeships, because you're running an apprenticeship program for directors, correct?
It is an apprenticeship program to take you from a lead teacher and put you on the path towards director certification.
And what are you learning from that?
We are learning from that one, it creates a pathway that might be right. What takes talent and enables them to take that next step into senior leadership and administrative roles. I think not unique to Massachusetts. Many might go into the director role because they have been the most senior teacher, not necessarily because they had the most training in sort of business acumen or HR. And so what this apprenticeship really offers is, one, sort of a unique pathway to becoming a director, and two, this ability to get on the job training and skills building. So you're not just taking a course in how do I do prospective budgeting or how do I build team culture, but you're actively getting to practice those skills on the job. We also hear a lot, the big benefit of it is community. You feel like you are supported, whether that's within the context of your school or amongst the community of other directors going through this track. We have a great video that we would love to share after, actually about an early educator who did this program with her mother, who was also an early educator. I mean, just a great human story of both saying, if the mother was saying this is so different than how I came up, and the daughter saying, and now I feel like I can sort of take it to this next level because of support, community, and then lastly, compensation. That with the apprenticeship programs, these are registered with the Department of Labor. So these apprentices receive wage bumps as they go along in their training and experience on the job. So I think that's both, right, incentive to stay at it, as well as recognition that as you go along building skills, just as we would do in K-12 or other professions, we would assign you increased compensation for that experience.
Yeah, I think it's one of the things that our audience may not understand is about registered apprentice versus all other. And I do think that, and we here at BPC support registered apprentice because they do have that requirement for some kind of national or some certificate or recognition of what they're getting, the training, but they also require the wage bumps. And we can't keep training this workforce and then not rewarding that. It's pretty sad the way we have treated that. So back to you think that what you're learning aligns with some of what we have in this report?
I think certainly what we're learning with respect to defining the workforce comprehensively, yes, that assigning then very clear credentials, yes, as well as identifying competencies that assign to them. And I think registered apprenticeships really put all of those things nicely into conversation because you do exit with a credential to which, right, you can assign very specific competencies and then stack them. We have apprentices who just finished our so there's two tracks. The first is teacher to lead teacher, and then the second track, lead teacher on your way towards director certification. And so those who just graduated from our first cohort of apprentices, we started this program in January of last year and just had a graduation of, there were, I think, 70 apprentices who graduated in a graduation that had 300 people at it. And I mention that because, and I don't know that we even expected this, people showed up dressed to the nines. Their partners, their parents, their children were with them. They were taking pictures. It was very clear that this was a graduation. And I think that's important, that if we are a profession, that we own, right, that identity of being a professional. So those, first cohort of lead teacher apprentices now immediately signing up as we launch this next cohort to do the director track.
Interesting. Okay, Marika, we're going to go to you next and have you tell a little bit about some of the work that you've done, especially with the Bainham Foundation, and talk to us about, I guess, the issues between some of the things that we look as are short-term fixes versus the long-term. And, we have a real challenging road in front of us in early childhood. How do you balance those when the needs are so great right now versus the long haul?
Sure. At the Bainham Family Foundation, we are all about creating a society where young children can thrive, and certainly early childhood education is a necessity for young children thriving. In our work, our early childhood work, it's a combination of navigating while reimagining. So 80% of our portfolio is focused on partners, mostly early learning programs, and those who advocate for early childhood as they just navigate the current system, making sense of all the incoherence and the inadequate funding that is in the current system. So we trust our partners to use the resources we provide, leverage additional resources in their community to do the best they can with young children. They also provided an opportunity for us to examine the complexity of the current system without normalizing it. From our perspective and pouring through their reports, working alongside them, conducting site visits, we see how the incoherence impacts them, particularly around the workforce. So it is not rare to have an early childhood education program we partner with to navigate 6 regulations, all impacting the competence and effectiveness of the early childhood workforce. They often have to blend and braid Head Start funding, early Head Start funding, childcare subsidy funding, which requires QRIS because they identify as a member of the early childhood profession. They also want NAOIC accreditation. If they want to do Montessori as well, they navigate that. And then comes childcare licensing. If they want public pre-K, they're navigating that as well. So one partner may be navigating in 8, 9 regulations, all focused on the competence of the early childhood educators, but in many ways they're conflicting. Even I say it all the time that it took me 20 years in this field to realize the expectation for an educator or a teacher in Head Start varies from early Head Start. I was like, okay, that's a level of incoherence I wasn't ready for. But so we see, how they're trying the best to make sense of the incoherence, which is why we launched the We Vision Early Ed initiative to frankly escape the current for a minute and reimagine what a more coherent, effective, equitable childcare system could look like. And so we're partnering with early learning programs who are ready to make the ideal real. And part of making the ideal real, frankly, is giving the professions, the profession, the autonomy they need to do their jobs well. So right now, some of these programs are funded to identify what is the true cost of quality and how do you define the cost of quality while being unapologetic about the competence of the educator, the compensation they deserve, the well-being supports that deserve, and not burdening families with that. So it's all about navigating the current system, but earmarking time and space and tools to reimagine what it could look like if we had the ideal system.
I was in a meeting last week with Marika, and she has a list of questions, which I cannot stop thinking about. I think one of the questions that I asked you during that meeting was, do we have a profession?
I think we have some components of what defines a profession. I think we have many individuals who see themselves as member of a profession because, frankly, licensing regulations and other policies have told them they are. But in comparison to other professions, we early childhood profession looks significantly different in many ways. One of the hallmarks of a profession is autonomy, its ability to self-regulate, its autonomy to create standards and accreditation systems and exams and assessment, and certainly alongside with state administrators or federal agencies. So the level of governance, the way in which governance in the early childhood space is all, frankly, state administrators and federal agencies defining core components of the identity of the early childhood profession. The fact that quality gets defined by a governance body or quality rating system, just the way in which we see licensing systems and state administrators not leveraging profession-led systems like CDA, accreditation exams. We talk about nursing a lot. It will be hard for us to find any policies regulating any profession that is not naming in multiple places their professional organizations, those accreditation systems, the exam. We use nurses as an example. Every single registered nurse takes the NCLEX exam before they can practice. That exam is not held by a state entity. It is not held by a state administrator. It is the government's way of leveraging the tools that the profession provides. So that symbiotic relationship between the profession and state administrators, we don't see in early childhood education. That level of the lack of autonomy to practice and self-regulate, we don't see that in early childhood education, which is why the purists would say early childhood education and the early childhood educators as a profession does not exist in its current structure.
Well, we're going to go next to Calvin. And Calvin, you head up, I think, one of the most important efforts in this country, and that's CDA. And I can say that I started a program in the military when the CDA was just invented. So don't do the math on how old that makes me, but I do think that the CDA is one of the most important things that this country has done. What is your take on all of this now? And maybe you could, key off of what Marika was talking about, a profession a little bit.
Thanks, Linda. I do think Marika has hit it right on the head. I think that it's clear to everyone that's looking at the incoherence in our field that we have some hallmarks, but we're not a defined profession. I'd like to start with the history of the CDA, though, because it's very interesting. The CDA was created in the early 1970s as a workforce solution. Head Start programs were expanding across the country, and they wanted to create a credential that would qualify individuals to work and execute the program across the country. And so the birth of the CDA was really important as a workforce innovation. And I think that that's important because shortly after Head Start adopted it as an innovation to solve that problem, the military child care programs began to adopt the CDA as well. So we see another system adopting this credential as an entry-level credential or entry point for the profession. We don't have an entry point. We've not defined the profession, and we've not set a gate to say this is how you enter. The CDA is our best play at that. We see that when it's recognized by a federal program and the military program, we see that it is an access point for entry into the field. What I would say about the CDA in terms of state leadership and offer some wisdom is that this work is very complex. Administering a credentialing program that's national, portable, transferable across state lines is very complex. We've been doing it for 40 years at the council, and we still have not figured out all the nuances to doing this well. And so what we offer as a national credentialing organization is the history of doing it at scale when it was never meant to scale. And I think it has caused additional incoherence from state to state, trying to create their own credentials to meet the demand that the workforce is demanding. The other thing I would offer is that our national CDA competency standards, they were a gift to the field. We want people to use them. We want people to embrace them. We believe that those standards are essential to making sure that folks understand these are the requirements. This is the knowledge and skill and the competencies that we think are best suited for entry into the profession.
You and I have had this conversation, but I'm going to put you on the spot and ask you the question anyway. There is a debate in the field about the competency versus education. And what are your thoughts on that since you oversee the competency piece of this?
Right. Chicken or the egg? So I'm going to go out on a limb, Linda, because I'm a straight shooter. I believe competence matters. And I think that is essential in the work that I do. I earned my credential in 1992. Coming from outside the field into the field, the CDA was the best thing I ever did. I think corporate America has figured that out. They figured out that they would rather have a competent worker who understands the job and the skills necessary to do the work that they require over a degree. I do believe that the education attainment pathway has merit. God knows I have every degree that we offer in our field, including the CDA. But what I know is that the CDA combines practical experience with high quality training, and you verify based on performance exam that the person is qualified and competent to do the work that they're required to do. So competence matters, but I do believe that it should lead to additional sharpening of your skills through education attainment.
Before we move on to Walter, would any of you disagree with that?
I mean, I often find it interesting that we sometimes challenge the importance and benefits of education, yet we're in an early childhood education profession. That dichotomy always sort of intrigues me. I do feel like the early childhood educators themselves, as currently structured, do want portable, stackable, relevant degrees and credential. We support many in the city earn their CDA credential, and those who graduate are eager to start their associate's degree program, and we make sure they're accessible. University of DC, for example, provides associate's degree in early childhood education in Spanish to ensure that pipeline exists. And many of those also want to earn sort of the bachelor's degree as well. So I think part of it is creating a more coherent pathway, a pathway that makes sense, that includes compensation and a defined scope of practice. I think what we see right now in a lot of the career lattices, and those lattices inform the registries, is you could have a 12-step career lattice and your salary is still the same. As you navigate from step 1 to step 12, your scope of practice is exactly the same. Whereas in other professions, when you earn your competencies determine the level, the scope of practice, which is why nurses we see, you earn these competencies, you take this assessment, you can now practice as a CNA. You earn these set of competencies, you take this assessment, you can practice as an LPN. Same with RN, where the competencies get more complicated based on your scope of practice and your responsibility and accountability to the individuals you're serving. Whereas in early childhood, again, you can have a master's degree in early childhood education or a CDA, and your compensation and scope of practice will be exactly the same.
And I think maybe just one thing I might add is the role that state administrators can play in helping to navigate what are the credentials, what are the competencies in order to achieve them, because if it feels opaque to us, to the educator, it's extremely difficult to navigate. And I think even to the employer provider, it's extremely difficult to navigate. And so in Massachusetts, I see some positive development towards how to create no wrong door approaches, even if it's a messy system that we have right now, at least helping educators be able to navigate. What is it that I'm looking to achieve? Am I trying to move to a lead teacher position? How can I get there, right? Can there be a centralized person, whether they are built within government, whether they are, as we were at one point in time, a contractor, to say, where are you trying to go? How can we help you get there? And then drawing on, pre-existing resources that might be there. So the example of free community college classes. Absent some of that navigation support, our educators don't know they're there, our providers don't know they're there because they're doing their day jobs and they're not getting paid enough to do them. So I think that's just another kind of element of the report that I appreciated, which is how can we think about infrastructure building to help us achieve our goals of educators getting credentials, stackable credentials, et cetera.
It is one of the things that we have thought about a lot with the report, and it's one of the ways, some of the things that we put out early on this report, where it's not just about compensation, but it's not just about any one of these things. It's about all of them, and I think we have to have the compensation. You can't have people going through, college courses and still making minimum wage. I mean, we have to deal with that, but I guess it's what you're saying, both of you, is reinforcing kind of what we set out to do. The other thing that I would recommend to our audience is that they really do, if you don't understand what happened with the nursing profession and how they became a profession, it's in the attachments in the report, and I really think people should read that, because it doesn't happen overnight. You just don't say you're a profession and then all of a sudden you are. It was complicated, but in many ways, when I reread the report last night, I was thinking, we've just been through something similar to what happened with the nursing profession during the war. And during COVID, I think this came out very clearly what needed to, that we needed to deal with this. And so I think people we have an opportunity, is what I'm trying to say here, of potentially doing something about this. Walter, I'm going to turn to you now because you're well known for your work in mental health, and especially with the early childhood community. And one of the other things that we know is that we have a very stressed out group of people. And why wouldn't they be? They're poorly paid. They've got, if anybody ever thinks it's easy to work in childcare, just go be there for one day and you will understand how stressful it is.
Half a day.
I would say yes, half a day. So tell us a little bit more about what you've been doing. We know the work on expulsion that you've been doing, but also how does that kind of coincide with the work on the mental health of the workforce and what you found out during COVID?
Sure. Thank you, Linda. But first off, thank you, Linda and BPC, for just even taking on this topic. It's a complicated one, and it's just wonderful that you're doing this and leading the way. So sadly, at the beginning of the pandemic, in the first year of the pandemic, 38 child care providers, professionals, lost their life per 100,000 employed due to COVID-19. COVID-19 was listed on their death certificate as the reason for their death. That 38 per 100,000 is significantly more than 30 per 100,000 for essential workers in average, significantly higher than 16 per 100,000 for non-essential workers, and it happens to also be 16 for K through 12 providers. Now, when we did a study to try to understand whether COVID-19 might be particularly likely to be spread because of childcare programs, we couldn't find any evidence to suggest that that childcare programs were contributing significantly to the spread of COVID-19. And it wasn't associated with an increased likelihood of contracting COVID-19 if a childcare provider worked in the childcare program versus stayed at home, wasn't significantly related to complications due to COVID-19. So it didn't appear to be the childcare program itself that was contributing to this. But when we dug a little bit deeper, it became clear what probably is contributing to it. The fact that we pay them so terribly. And as a result of paying them so terribly, they tended to live in substandard housing. They weren't able to sequester themselves when they got sick. It was more likely that if they had another adult living in the home, that other adult was also an essential worker in order to be able to make ends meet. Because they were hourly workers, when they did get sick, in many cases, they might have gone back to work anyway because they had to make ends meet. And they didn't have access to health care at the same level of real professions. All of those things. So it didn't really seem to be the exposure to childcare that was leading to it. It was the exposure to how poorly we treat childcare providers in this nation that was really leading to that. 3 months into the pandemic, we were conducting a large-scale epidemiologic study of the health and well-being of the early care and education workforce, a study that was made possible only due to the National Workforce Registry Alliance and the state child care registries that allowed us to be able to find these early care and education providers and be able to track them. I'm looking out there in the audience and I see Dr. Bedell Belcher, and it was only because of that we were able to do this study in the first place. What we found was 3 months into the pandemic, 46% of our early care and education providers were screening positive for diagnosable levels of depression. I don't mean 46% were sad every once in a while. I mean 46% potentially diagnosable with major depression. By a year and a half into the pandemic, that 46% became 56%. About 2/3 of them reporting on a standardized measure of stress that they were experiencing moderate to severe stress levels that could actually negatively impact their health and well-being. 2/3. 2/3 of them. That is an unsustainable reality for any workforce, nonetheless a profession. And so when I think about it from that perspective, clearly this is a workforce that even before the pandemic was experiencing lots of stress, and during the pandemic it heightened it. When we looked at the relationship between pay and job security and stress levels, clear relationship. If you think about it in terms of people who never lost a day of work nor a dollar of pay due to the pandemic versus those who lost some work days, but they were still at least paid, versus those who lost work and pay, versus those who actually lost their job. That mirrored increasing stress levels and depression levels in this workforce. In the first year of the pandemic, most of those who dropped out of the field were mostly people who were older in the field. There were people who retired early because they were concerned about their health conditions. After that, it was mostly our younger early care and education providers, especially those that were experiencing large amounts of anxiety, stress, and depression. In other words, in the first year of our pandemic, we lost most of our wisdom in the field. After that, we might mostly losing our future in the field. That's the realities that we were finding with this. And so one of the things that I applaud about the details of the report that you put out is that it makes it very clear that this is a field that has talked for a long time about the importance of the whole child. And we need to also be talking about the importance of the whole child professional, that these are whole people, that these are individuals, and that their pay has an impact not only on their ability to be able to make ends meet at home, but their own mental health. And then that's going to have a relationship, of course, to how well they're able to relate to the children and take care of those children in their care.
Absolutely. So when we talk about the preparation of the workforce and the issue of the numbers who have severe depression, where do we go with that? And what is part of the solution here? We know it's partly pay, some of it's preparation for their work that a lot of them don't have. What else would you say, Walter, we should be doing?
Call me old-fashioned, but I think the best way to sometimes address stress is to figure out what the stressors are and try to remove them. We asked early care and education providers. We asked early care and education providers what are some of the things that stress them out, especially the ones who left the field. We gave them an exit interview. And what they said was low pay, difficulties making ends meet, but also inflexibility of work hours. They didn't have somebody who could come in and provide substitute care for them to be able to take care of their own children in some cases. And also difficulties in dealing with challenging behaviors in the classroom. If you have a child who's stressed out, it becomes incredibly difficult to be able to manage that behavior if you yourself are also stressed out. And in addition to all of that, just the general feeling of a lack of respect. That was a top reason that many people said when they left the field, that one of the reasons that they cited was they felt like they didn't get much respect being in this profession. I think we need to address those things. I think we need to address them fundamentally in terms of thinking about how do we remove some of those barriers by providing them supports that they need and that they ask for in terms of how to manage challenging behaviors, that a teacher shouldn't be left out there as a lone ranger to manage challenging behaviors. You were talking before about the importance of these ancillary support services. Well, those are incredibly important, not only because of the services that they provide to the children, but also because they are a support to those early care and education providers. Nurses have others who help them in their work. Doctors have other people who help them in their work. Early care and education providers need to have that too. For us to be able to think about those things, but also to think about maybe direct provision of employee assistance to early care and education providers. That they should be able to have benefits to allow them to be able to get health care, mental health care, but also perhaps we should be thinking about what are support systems that could be provided in order to help support the mental health and well-being of our early care and education providers directly. One of the things that we had noticed too was that a significant number of our early care and education providers were reporting exposure to racialized aggression. That in their daily lives, they were reporting that they had experienced either verbal or physical aggression directed towards them because of their race. We don't provide much support specifically for this field about that, even though we know that this field is a field that's overwhelmingly women, and unfortunately women are often the targets of aggression at the community and within their homes, and that in many communities we're talking about a workforce that's disproportionately women of color, that we cannot anticipate that this would be a need of this field, and then try to provide supports for that, I think is a shameful reality. Another hallmark of professions is that professions tend to take care of themselves, and they think about their own well-being. And I think it's about time that we start thinking not just about the worth of early care and education providers because they provide something beneficial to children and that they provide something beneficial to families in order for them to go to work, but also think about the worth of early care and education professionals because they themselves are worth thinking about.
So where do we go from here? I know we really want to get a few questions from the audience, and I do think that you paint a pretty serious picture there of where do we go. I mean, of the challenges. I'm very concerned that we're missing an opportunity based on what we should have learned from studies like what you did, from the experiences in COVID, what everyone here has talked about. How do we turn this around in this field? And I know that's a huge question, but I think it's getting to be very serious, and I'm concerned we're going to lose an opportunity to learn from this devastating time in our lives.
I think we need purpose. I think we need to galvanize the field in a way that is purpose driven. I also believe that we need leadership throughout our system where our early childhood profession can really say what they want. And I think it's a failure to listen. I mean, do we want to be a profession? I mean, we have to answer that essential question. And if we do, we need to provide leadership for people can decide what our purpose is, what is our specialized body of knowledge that we can all subscribe to, and then what are our demands as a profession.
I'll also say, given that this report is directed to state administrators, I'll say state administrators have a responsibility to make it make sense the level and sort of address the sort of incoherence, right? And recognize that the early childhood profession, as it exists today, is also not a blank slate. So if you find yourself as a state administrator writing your own competencies, red flag, you're doing too much. Competencies already exist. If you find yourself creating your own custom assessment, red flag, one already exists. One of the significant mindset shifts we have to make as we seek to advance this profession is the level of power sharing, right? Like, if you recognize early childhood education as a profession, then you must recognize that it's not a blank slate like all the other profession. It comes with, in some cases, years and years, decades of
The
competencies.
CDA is 50 years old next year.
Yeah. It comes with accreditation of higher ed. So you don't go try to make higher ed make sense on your own. Go to the profession and say, hey, profession, what tools do you already have to do so? So I think part of it is, frankly, it's going to be power sharing, where state administrators are asking themselves, which decisions do I absolutely have to make because the profession has not addressed this, and which decisions have already been made and systems have already been set up by the profession that can be leveraged. I love the reference to the apprentice in apprenticeships, which is why they call for industry recognized credential. It wasn't states go out on your own and figure it out. It has to be industry recognized, which oftentimes means it's portable and stackable, like the CDA credential.
Two things. One, to follow up on that, and I think, Linda, you may have mentioned it, but interagency collaboration. So the success of the apprenticeship program is because there's collaboration between our executive of workforce and labor development, our Department of Early Education and Care, and perhaps the next step, right, to your point about we need to be investing in the mental health of our caregivers with our body of Department of Health and Human Services. I think something as well that I appreciated in the report and didn't have a time, I see we're clock countdown, but is how we weave this into cost modeling. Our state administrators, right, are a function of the conditions in which they can act. So as we do cost modeling, it's yes, what do we want our teachers to be paid based on a salary scale? It is also who is missing in the building so that our teachers don't burn out and leave, that our directors don't burn out and leave. But I think it is also in recognition that how do we create the conditions that our state administrators have the staff to go and administer these programs, to evaluate competencies, to make sure that we are building a strong system. This is an argument we make at the state level, is to be successful, we need to treat our state agencies the way that we would treat, in Massachusetts, the Department of Elementary and Secondary Education. A staff of a lot of people with a lot of money. How do we think about administration of early education and care in a systematic way, the way that we have applied that same respect to K-12 education?
Yeah, we've been looking at that governance issue, and one of the other things, we're seeing progress on that, and we saw some last week. I think Illinois is going to, relook its governance structure here soon, too. So we're seeing some progress on that, but I think that is a huge barrier to progress in this field.
And just to say, and with governance, it's important to recognize that there are no state boards regulating the practice of early childhood educators. There's
Right.
Board of Nursing, locksmiths have a board, manicurists have, right? There are no
Yes.
boards regulating the practice of early childhood educators working in the childcare space.
We license buildings.
You do.
We license buildings, we don't license the individuals that are in them, even though it is the individuals that are in them that's doing that work. So the point of apprenticeships that we've been talking about here, it reminds me of a conversation that I had a few weeks ago with somebody who was running a very large and very successful apprenticeship program, and I won't name the specific program, but I talked to the person and I said, well, why is it that you don't have an apprenticeship program specific to early care and education providers? And the person was very honest with me and told me the truth. And he said, well, our philanthropic funding is to support apprenticeship programs to lift people out of poverty. We'd be just lifting them back in. And ultimately, it raises this issue of much of the things that we're talking about probably aren't going to be possible unless we're talking about significant infusions of resources into the early care and education industry, understanding the fact that this is a core infrastructure for America. There are two things that many Americans needed in order to be able to get to work today: a road to drive on and somebody to take care of their kids. And until we start to think about the fact that this is a core infrastructure and start funding it as a core infrastructure, then it's going to be difficult to be able to have the resources necessary, I'm afraid, to do much of the things that we're talking about.
We want to open it up to questions right now in the audience and in the watching the audience watching online, to see what questions you have, or if you've had a chance to look at the report and tell us anything, what you're thinking about that right now. Any questions here? Okay. Well, then we'll keep going with it. We do have online questions coming in, but they're still, we don't have them yet. So we'll keep waiting for those. There's, a couple of other things, and I think, Walter, building off what you said in the whole panel, what I struggle with is what comes first, the chicken or the egg? Is it, right now, we say this in the report, we know we need to fix the pay of the workforce. But how do we get there if we don't have the basic facts about the workforce itself? We don't know how many we have. We are working right now on a report, 50 state by state report on just the demographics of this field. And it's surprising to me how many states don't have basic information on their workforce.
Registries. That's the answer.
No, that's who we're working with.
Absolutely.
And how many states actually have a registry is the question. And we're going state by state and asking them for the data. And there are states that really don't know how many of anything. How many teachers, how many assistant teachers, how many directors, what do we have here? And I think we have to deal with the data issue. We have to deal with the definition. One of the things we were corrected on, and it was our issue, but we had a mistake in the age of one state, and the state actually called us to tell us that no, the entry level age wasn't 16, it was 14. And how do we begin to deal with those kinds of issues? I know that that's a real challenging question, but that is where we are.
We have to measure it. We have to measure it. Things like child care registries is an attempt to be able to count the workforce so that the workforce can count. And until we have access to information about this workforce, it is going to be difficult to be able to make persuasive arguments to people. The notion that we can find the buildings that we support in early care and education, but that we'd have no idea who it is that's actually in those buildings, actually providing the care, is fascinating to me. To the point that you were making earlier, the fact that we license manicurists, but we don't license those individuals that actually provide care. And in the absence of a licensing of individuals, the workforce registries are the only thing that we have in order for us to be able to actually know who it is that's taking care of children, understand what their needs are, and understand how best to advocate for them. It is our best chance at making a workforce that's largely been invisible much more visible so that we can actually be useful in addressing their needs.
And that is one of the things that we say about the state administrators. They have the potential to make sure that we have these registries. And I think that's a big gap that could be fairly easily filled. Now, we also know in the work that we're doing that a lot of states are working on them now because they learned something, again, from COVID about what they didn't know about the workforce when COVID hit. So that's, that's an important part of this. We do have some questions now
But
from
Linda, I
the
just want to suggest that
Sure.
if we don't define ourselves for ourselves, then other folks will do that. And so that's why you see the variation of teacher qualifications across this country, including the age requirement, because we can't push back on that age requirement if we're not clearly defining ourselves for ourselves. And I think the lack of that clarity as a profession allows other folks to tell us who can do our work.
And how do we make the registries requirement for all, right? This is a very
Yeah.
fragmented workforce where if you're getting funding from the public pre-K system, perhaps the registry is an option, right? You're only required in some states to provide registry data if you're tapping into the subsidy, the childcare subsidy system. So how do we decouple the funding streams from the identity of the profession as well as the building type? I definitely understand why digging into sort of the family childcare could have made this unduly complicated, even though that's not a value statement. But we're so focused on the funding streams and the building types that we lose the focus on the individual. Are you an early childhood educator? And then we can figure out what building you work in. Whereas in this space, your funding determines who you are. You're a Head Start educator, you're a pre-K educator, you're a home-based early childhood educator. The funding streams and the building type should not take precedence.
In 1971, we came incredibly close to passing a piece of legislation that would have created a unified system of early care and education. And unfortunately, in 1971, when it passed the House overwhelmingly, the Senate overwhelmingly, but then was vetoed by Nixon, Humpty Dumpty fell off the wall. And he broke into a bunch of pieces, and all the king's men and all the king's horses have never put him back together again. And unfortunately, we have inherited this incredibly fragmented system, and then in the process also created fragmented educational programs, fragmented credentialing, fragmented support systems, fragmented everything else in order to further support and calcify that fragmented system that we inherited from 1971.
But you did create the CDA in 1960.
That we got. That we got.
Yes, but again, that's why for us in our work, as we focus on sort of reimagining the system, it is going to be about power dynamic because we do have definitions, we do have competencies, we do have exams. It's an issue of do we have the willpower, and frankly, are we willing to share power in a way that we actually all designate X entity as the one that's going to establish the baseline on quality? Are we all going to be comfortable sharing power with the council as the best first step?
And the council is willing to share power with the profession.
Absolutely, are we all winning, right? Because other professions have a baseline and they're all comfortable pointing to that baseline. But you have to lose a lot of power control to be able to, paternalistic thinking to be able to do that. And trust, right? To be able to do that. And so I think what we're seeing is these standards do exist, these baselines do exist, the decisions and guidelines and unifying frameworks do exist, but do we have the power to, ability to share our power and name those baselines?
If I understood that we were working on behalf of the field, I'm all in.
I think everyone is. Yeah, I think where we get stuck often, and I'm curious as to what you think about this, I think we see things as either or, and we do not see the gray in so much of the work that we need to be doing here. And so either it's a degree or a credential or competency, and it's really both. I mean, I think we've all kind of said that, and we need the pathways, and I think we've all said that. So I don't know how you change that mindset out there in our community to it's a both and where do we go with this? I'm curious about that. We have some questions up there, and I agree with the first one. Basically, ECE doesn't have a wage issue; we have a funding issue, and I completely agree with that. And I go beyond saying it's just funding issue, but it's also how the money goes into the field that's going to have to be figured out in this country. But the question is, like K-12 system, community colleges, public libraries, so we're sustainable. Well, that is a good question, but I go back to the fact that we need to figure out how much do we need and what is it going to cost us, because we have not done that work yet in any way.
Can I add for one thing, Linda, to that, just again, sort of real-time example of maybe, seeing in crisis of COVID opportunity to try things a little bit differently. Yes, how much? And we need to know that in the cost modeling, right? Telling us we need to get from this daily rate to that daily rate and optimally to this sort of annualized figure. But then how the money comes in is what we're hearing loud and clear from the field has such a difference on the risk that they feel that they can take when it comes to building up their workforce. So during the pandemic with the ARPA funds, right, packaged into these direct-to-provider stabilization grants, we have an uptake in Massachusetts of, I think, more than 90%. So we went from a field that was like maybe 58% participation in child care financial assistance, CCDBG, to now a field that's 90% of it taking some level of government funding. Now our CCDBG participation rate leaves something to be desired, but I say this because what we are hearing from providers is the money coming in a direct-to-provider operations grant form is what enables me to make a longer-term investment.
That's right. Yeah.
And what we also hear from providers is, yes, it needs to be more if you want us to take wage from X to Y, but permanency. We need to know this funding source is permanent because then, right, we feel okay as small business employers, not just knowing I can give you a raise rather than a one-time bonus, but that I can encourage you to move along this career lattice or ladder because I know I will be able to compensate you for that. And so I mention this just because, yes, we have a big number funding problem, but I do think we have opportunity in how we put those funds into the field, sort of thanks to COVID, enabling us to do things differently when it comes to investing public money into the childcare sector.
And I'm really worried that we're missing that point in the stabilization funding. It worked, and I think anybody who wants to say it didn't, it did work. It stabilized this field at a point when it probably really would have collapsed. Had we not had it. But now we're sort of edging our way back to, well, it's more about subsidy. We need to increase the amount, the subsidy, the value of that to a certain population. And I worry that we're missing the point. And I'm going to make one point that I think everyone on this panel has heard me say. In the military system is the other system that has withstood the test of time.
That's right.
And when people, in thinking back over that, the one thing I now say to people who want to know why it happened, yes, we paid better wages, yes, we trained them, but we put the money into the program and said to the program, in exchange for this, you're going to increase the pay, you're going to train these people, and you're going to give them benefits. And oh, by the way, you're not going to raise the fees to parents. Right. And what we keep saying, and now we're going back to this idea that if we just get subsidy dollars up, well, subsidy isn't enough of the market right now to drive this thing to change. It just really isn't possible. So I'll get off but I think to your point, it's not just how much, but how the money goes into these programs.
And you could see it in pretty simple, sort of math equations. Is in Massachusetts, we are fortunate that reimbursement is tied to enrollment, but enrollment is reported on a monthly basis. So it goes like this. You see the direct to provider operations grant, right? Mirror what it is to run a small business in childcare, which is I have fixed annual costs. And so I do think that provides, frankly, like the future of childcare financing if we can bump that direct-to-provider operations grants to a high enough level where you can say, here's our metric of accountability. This is your salary scale, right? Here is how you ensure the credentialing, the competencies, and other elements of quality building that helps to sort of raise all votes.
We're at a critical point in the national conversation on this because we are at risk of losing our moment. on this.
Exactly.
And we're in the middle of a moment, and we are emerging out of that moment. And I feel like I'm being a bit of an unrequested historian here, but this is reminding me of the Lanham Act, going way back to World War II, when we actually had universal child care in the United States, and it was in order to be able to support the war, and it was because G.I. Joe was out fighting the war, and somebody needed to be able to be in the factories, and so Rosie the Riveter went to the factories, and we provided subsidization for child care during that time. But then when G.I. Joe came back, and he wanted his jobs back, then Rosie the Riveter was out of a job, and we discontinued the Lanham child care programs. We are at a moment right now where we will either shift this conversation towards meaningful long-term solutions instead of short-term fixes, or that we'll settle for going right back to short-term fixes and watching them expire.
Exactly. We have a couple more questions, and I think a couple of these we can put together. It says, in what ways can innovation in the states rely on BPC's reach and network to elevate the work, what's happening across the country? And the second question, adding on to that, is, are the early Head Start childcare standards and staff qualifications the model for states to use in building a uniform system? I think the partnerships kind of are what we've spent a lot of time here at BPC looking at the early Head Start childcare partnerships. And how do we elevate the childcare to a higher level, that being an interim, I think. And what I keep saying is that yes, I think they are. And they're not that high compared to what we want to see in most states. And I'm pretty sure in Massachusetts standards are, fairly equivalent to Head Start standards. We have a perception, though, in this country that Head Start is way over here, child care is over here, and never the two shall meet. And just going back to our work, we're looking at that very seriously as a model. Why aren't we using what we've learned? You said it, from CDA, from Head Start, from these other programs. We point that out in the report, but we're not doing it.
I just don't think we have the public will to expand these programs. I mean, wouldn't it be nice in this country if we had Head Start and early Head Start for all? I mean, if it's a model that works, shouldn't we
Right.
be investing in it for everyone?
Well, because they're part of the problem that Marika, you were talking about. They're one of those.
Right.
It's these funding streams, and I know if anybody says anything, nobody wants to give up their power. And I do think as a field, we're going to have to deal with that.
Absolutely. And the military child care for me provides a really good example of that. The military child care system in its policies leveraged quality standards. They didn't define it
bet.
themselves. They didn't create their own military QRS. They leveraged, and I'll argue that was one of the ways in which they're able to have more funding directed to the programs, because they were not reinventing the wheel and trying to play the role of the profession. The
one thing about the military that we're talking about, and I think most people don't know that. They always say the military standards are really high, right? Actually, when we developed those standards, we took all 50 states, laid them out, and then took the middle. But the difference was we enforced them and we trained to them. And so I think that what we have are a lot of confusing things going on. I mean, to this day, you can go look at them and see that.
And you have a very transient workforce, right?
Yes,
But
absolutely.
having that level of uniformity allows and supports a transient workforce, right? It means that the baseline quality was early established. So an educator working at Fort Bragg and having to sort of get to another military base in 2 weeks could enter that classroom and be effective at practice, because you have that unifying baseline standard in place.
The expectations are clear.
Yep.
The pay scale is really clear. The standards of quality in the military child care program is clear, and then they make the funding available. I mean, we just signed a new contract with the military programs. Every person in the military that wants a CDA can
have
get a
it.
CDA.
Wow.
Simplicity is going to be the innovation.
Yeah. And I think the other thing that was important about that is that we trained to the CDA in the military system, but we never required the actual certificate, but they had to meet the competencies of it. So why not get it? I mean, we would pay for it, but we weren't forcing a credential as much as we were forcing the competency on the
And you did the same
work.
thing with the school age. The military school age program is just as vibrant.
Anyway, let's see what we have here. The report suggests that quality dollars are the one lever state administrators may pull to support the child care workforce better. Would you support a more targeted use of quality dollars, specifically targeting the workforce recruitment and retention? Thoughts? I have thoughts on that, obviously.
Yes. Yes, I would, and I would increase those quality set-aside dollars.
I'll say yes, but I'll make sure that the child care programs and administrators have the autonomy for determining what is the most impactful recruitment and retention investment.
I think we have a lot to learn from what happened when we stabilized the child care workforce. I mean, that infusion of dollars did an enormous public good. And I think, of course, if it works.
And I'll concur with that and just say again, on this sort of note of direct to provider investment in Massachusetts. So Massachusetts stepped forward and state funds now support the ongoing program of these. We're trying not to call them stabilization grants anymore, but operations grants. But worked into that funding formula to get at quality is a staffing adjustment. So if you hire sort of more educators than you're legally required to be at ratio, we recognize and reward that, both because it will help improve supply and access and quality at the same time.
Just before the pandemic, Daphne Bassock, the University of Virginia, did this study. I don't know how many people are familiar with it, but she randomly assigned some early care and education providers to get a $1,500 retention bonus if and only if they stayed in the field for another 9 months. And then the other group didn't get it. And we all know exactly what happened. It significantly increased the number of people who stayed in the field. It cut retention rates down significantly. Then she did a second study where she randomly assigned some people to either get the $1,500 at the end or get it $500 every 3 months. Still, we have $1,500 either way. Now, many economists would make a guess as to which one would likely work better. Make them wait till the end to get the whole $1,500 as an incentive, or pay them $500 every 3 months along the way. Which one do you think it was that was significantly better at keeping people in the workforce?
15.
It was $500 every 3 months. And the reason why, yes, and the reason why is this. It wasn't an incentive. It's what they needed just to survive. And many economists would think of that as an incentive. And as an incentive, the incentives would typically work better if you make them wait until the end and give it to them at the end. But when you're talking about a workforce that's barely making ends meet and barely able to scrape by, this is not an incentive anymore. This is just what they need in order to be able to make it to the next month.
I think it also speaks to the mistrust as well.
Yeah.
Well, yeah.
In this field. I mean, I think the DC Pay Equity Fund is also another example of how we can sort of do the best we can to reimagine while navigating the existing system, where DC is trying to narrow the gap between early childhood educators within the public school system and those outside the public school system.
There's another question. This one's a good one. I think we've talked a little bit about it. Is this report places significant emphasis on the role of state administrators? Who else has a role to play?
We've seen at the council, we've been paying attention to the emergence of early childhood departments across states. And we've seen that they may be redefining the field to some degree. And in some cases, the state administrator sits outside of those departments, and in some cases, they're embedded within the department. I think those states that have those clearly defined departments that are focused on early childhood, I think they have some role to play in this reimagining of the field.
What about businesses? Do businesses have a role to play in terms of thinking of childcare as an important employee benefit necessary in order to be able to keep and sustain a viable workforce? What about the taxpayers? In terms of understanding, in some cases, where to send surplus dollars when those surplus dollars actually happen.
You know, you'd bring up business, and I think it's been really interesting, the field's reaction to the Department of Commerce's focus on the chip industry. And mixed emotions. I mean, some people think that's not the way to go. It could take away. It's another opportunity in my head to innovate and to get an industry, one in particular, to focus on the impact of childcare. They probably didn't think of it themselves, but they are now. If you're going to get several $1 billion, but I was curious as to the reaction within the field to whether or not that was a good thing. And I think we're split. Didn't we see that, Marika, last week, in terms of our own community on whether business should be there at all? We're pro, obviously, business being at the table, not because we think that they should provide it, but we need their support to solve the problem, for sure.
I'll also say sometimes in these conversations, it's as if we're asking others to provide the clarity that we need to provide. So I'll also put this back to the profession and say, you define yourself. If you can't get to the level of coherence, then you can't expect business to get there for you. So I think part of this moment in time, as Walter defines it, is for the profession to step up and say, here's how we're going to define quality. Here's going to be the baseline. Here's the compensation that we'll be willing to accept, versus just being sort of this clay that QRIS gets to define, and the state administrators get to define, and the business community gets to define, and the lawmakers and policymakers. Like that level of agility, we don't see it in other spaces. So I think the profession also has to step up and draw the line.
Completely agree. Going back to the earlier conversation about what makes for a profession. Typically, when I think about professions like being a physician, being a lawyer, these are jobs for which the benefit can be great and the potential harm can also be great. And so as a result, there's a general understanding that there needs to be some way to regulate what is happening within that industry. And there's also an assumption that the purchaser cannot be in a position to be able to adequately decide whether or not that is good quality or bad quality, harmful or helpful. And so as a result, then, there's this need for regulation, and the regulation is assumed by the profession itself as the only entity able to actually define what it means to do that job, who is in and who is not part of that. I think the first part is very clear. Clearly, the benefits of high-quality early care and education are huge, and the potential harms can also be huge if it's not delivered in a high-quality way. The question is whether or not we have the wherewithal to be able to put the professionals themselves in the position of policing and defining their own job, what it means to be an early care and education professional.
You know, back to the question though on the table, I also think that when I think about this, I think whoever benefits from childcare should be at the table. And it is more than business. It's healthcare, it's the public school system, it's obviously parents, it's the workforce that we have. I mean, to your point, Marika, we just need to open this up and let more people in. And it sometimes is uncomfortable, that happening, but I don't see how we can just continue to go it alone. Absolutely. And I don't know how we get people to to think that way. But you do it.
We're willing to try anything. But I do, I think there's a sort of few things here. One, as somebody who is not well steeped, right, in what does it mean to be a profession at a very kind of technical level, but I can say this from, the perspective of the provider community looking to employ professionalized educators, right, is I think it's a captain obvious statement, but sometimes you have to say it out loud anyway, is yes, it should be a profession, and yes, we need individuals coming through with clear credentials and competencies, and that is how we will get not just a sort of quality within one classroom, but an understanding of what quality looks like across the system. However, providers are desperate for teachers. And so that's where I think, right, you have to be running out. Whose responsibility is it? It's a social responsibility to figure out how much it costs and then figure out how you get that money in the door, because a provider would love to hire the most professionalized professional we can get, but in the meantime, can't keep anybody for more than 3 to 6 months. And so how do we both work in the current conditions, as I think, right, this conversation has really been steeped in what we as neighborhood villages, we will say all the time, we are not rocket scientists. We sort of find what's there and try to curate it so that the puzzle fits back together in a little bit of a more coherent way. But that we need to be mindful that if we want our objectives to actually be implementable, we have to apply pressure, whether that's at government level to put more public funds into the system or have the tough conversation with business, which is if you capture most of that immediate return, what's your meaningful skin in the game? And I think it's great to say we use public dollars to get private enterprise to do what we want them to do, offer childcare. But again, if we are envisioning a transformed system like we did with healthcare, that employers don't just get to advocate it, but that you either offer it or you pay into a system so that we're benefiting the community as a whole, not just, you employer who established your relationship for your one provider that serves your employees and is designed for the employer, not the child. Those, I think, are sort of the considerations of how do we really push on the funding piece of it, while as a field defining for ourselves what that end goal objective is.
And the news is not all bad. I mean, when I look at 2023 from the council's perspective, we credentialed over 45,000 individuals, and we passed our 1 million mark. And so the news is not all bad. I mean, people have been relatively solid in their pursuit of the credential. Even during the pandemic, we seem to be Teflon in some ways, particularly people coming back to renew their CDA after having let it expire, for example. So I think people are thirsty and hungry to sharpen their skills and to professionalize themselves. But I don't think, as you said, Marika, we have been as clear about what the entry points are.
In our We Vision Early Ed work, this is exactly what we did. We asked early childhood educators and families, what do you want in your ideal system? And pretended to be Oprah. And said, we'll give it to you. Do you know what they asked for? They want to make quality-centered and child-centered decisions. That's it. And so they are looking for standards. They're not adverse to sort of standards and even credentials, right? And we try to protect them from credentials they're asking for. They just only want it to make sense.
That's right.
Financial sense and sense for them as individuals. So.
And just, I think that there's a lot of great news. So registered apprenticeships in Massachusetts, the largest growing registered apprenticeship industry in Massachusetts is early education and care. We learned how to do it from Kentucky. So I think there was a question about what is the role that the Bipartisan Policy Center can play. Teach us what's happening in other states. Because if we can move faster at a state level on some of these entities that maybe we can at the federal government, Massachusetts and Kentucky don't get to play with each other very often. And this was phenomenal that they taught us how to build this program. And so I think if there are bright lights in a kind of more local level, I think you've got states who are hungry for how do we bring some coherency or how do we build up our pipeline? How do we keep our talent? So if something's working in Idaho, send them our way because we want to figure out what we can be doing at a local level.
Another Kentucky idea was free childcare for childcare providers.
Yeah.
And essentially, the whole wisdom behind that is understanding that when we're talking about a workforce, we're talking about a workforce of human beings who have human being needs, and that many of our early care and education providers are parents themselves. And when we start to think of them as human beings, then their needs will probably make a lot more sense to us.
Well, I hate to cut this off because it's been a great conversation, you guys, but we are out of time. So I want to thank you guys so much for making the time and participating in this. And I hope that we really get people out around this country thinking about it. I think we really do need to take time and opportunity when we have it. So I'm going to thank the panel. And then there are a few people I want to thank for the work on this report. And one of them is here with us, Sam Treeworthy, who in the early days of this was working with us here at BPC and started the outline for the report. Obviously, Caroline, Tara Williams, who's no longer with us, Rachel Owens, who's an intern here at BPC and spent a lot of time verifying information over the last several weeks. Olivia, and then the crew here at BPC. Everyone, this was a pretty tough lift, I have to say. It wasn't the easiest thing we've taken on. And then thank the audience for participating in the questions. And we'd love to hear from you. When we get the questions, we do try to get back to people if we've got questions. And we couldn't see all of them, so we'll figure that out. And then I think the last thing I'd like to say is that we have another webinar coming up this Friday. We just finished, as many of you know, we've done a series now of 10 surveys of parents. The one that we'll release on Friday is a survey of Hispanic working parents. And I think you'll see some very interesting things in that survey, in the survey results. We set out to test some of basically the beliefs of what Hispanic parents want, and I think we have some interesting answers. So I urge you to tune into that if that's something that you feel would be helpful. So with all of that, again, thank you to everyone, and hopefully see you on Friday.